Hello, I'm Dr. Shweta Mittal Gupta. I'm co-director and senior consultant at Center of IVF and Human Reproduction at Sir Ganga Hospital. Today I'll be discussing a very important and a very basic issue what the couples go through, and that is infertility. So let's start our journey by understanding that what is infertility. Infertility means that when couples are unable to conceive after 12 months of unprotected sexual intercourse. But it's not 12 months if the age of the female partner is 35 years and above. So what we suggest and what is recommended is that if the female partner is more than 35 years, then this investigation should start, or you should approach your fertility specialist even within when you have tried for 6 months and above. So this comes down to 6 months if the female age is 35 years or above. Now, what are the common causes? We can say that common causes, number one, could be related to the age. That is the most important single factor. The more the age of the female partner and even of the male partner, higher are the chances that they would be having fertility issues. Second, I would say, is weight. Now, overweight we know is bad, because the moment you are overweight, your estrogen levels could be high in the body, and that could lead to anovulation. Anovulation means where there is failure for a woman to ovulate, and she's not forming an egg properly and not ovulating at the right time. The couple might be missing the fertile days, or the fertile days are just not coming. Now, obesity is not only related to female partner, but even men, when they are overweight or grossly overweight, can also go through reduced androgen levels in their body, reduced testosterone levels, and which can cause infertility in men by reduction in the counts, the motility, and even the structure of the sperm, which is called oligoasthenoteratospermia. So keeping weight under control is very important. But there is also a word of caution, especially nowadays younger generation wants to go to gym, and sometimes they'll end up having protein powders, and also invariably they have steroids to make your abs, back abs. Do not indulge in steroid intake, especially for men, because that can tremendously reduce the sperm count, especially even to the extent that I had a couple where the sperm count had gone to 0 because he was consuming steroids. So not too much of hot showers or hot saunas. Now, coming to lifestyle, that's also another important factor for causing fertility issues. Now, in the younger generation, we are seeing a lot of smoking. So smoking is very harmful for the female partner also, and also for the male partner in affecting their gamete quality. So we would advise that refrain from smoking. Too much of alcohol intake, again in men, can reduce the male hormones and can tremendously affect the sperm production. Similarly, even in female, it can have a lot of effect on the egg quality, and later on, if they are pregnant, then they can cause anomalies in the baby. Then coming to your nutrition, a well-balanced diet is very important. So an appropriate quantity of proteins, carbohydrates and fats need to be taken. I don't think crash dieting is a good option. Keeping your weight under control by balanced diet and exercise is very, very essential and more important than anything else. So these are the normal general factors which you need to look after. I hope that this information was useful for you.